oli yagambye alina intaneti dede kavweddeko omusajja agambye ayina Go. I can't get the other questions they had asked. All right, we are back. We have a lot of technical challenges, but IT.next is trying. Today I have a lot of technical glitches, but our IT team is really trying so much. So we keep getting off and on. So every time you see us off, just go back to the channel and look for our live. We keep on putting more new links like that. I'm sorry, every time we get off, we lose the questions from the previous people that had asked. And therefore, if you had asked, I have not yet answered you, please ask your question again. This one is saying, Priscilla, answer my question. Please ask your question again. I may not be remembering the question. We got off. We have a technical glitch here. So we got off, so you can ask your question again. Ask your question again, I will answer. We got some technical problems here. But we are back. We are back. All right. Kathy Mbabazi is saying, Doc, how can I boost my egg quality? How can I boost my egg quality? Now, for those of you who would like to boost their egg quality, okay? I want you to first do tests, because some of you just said, doctor, get me drugs to boost my egg quality. When you've not done tests, when you don't know the quality of your egg, and you just think that because the reason as to why you're not conceiving is because your eggs have a poor quality. But before you ask any medicine, tell me that you have done an AMH level test. You've done AMH levels, okay? That is a fertility hormone. Tell me that you have done a transvaginal ultrasound scan. Then we can now talk about the egg quality. In most cases, egg quality depends on these fertility hormones. There is usually a hormone that is lacking. And therefore, if we know the levels of those hormones, you can get the treatment. So it's not all about just getting drugs to boost the egg quality. Let us know which deficiency you are having. I have said here that we are on evidence-based medicine. We are on evidence-based medicine. We don't just give medicines for, okay? We don't just give medicines for, we give medicines depending on your problem. Priscilla, I was asking if a person can get pregnant on day of ovulation. Yes, 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 and yes. I don't know how many yeses I can put there. On the ovulation day, it's when a woman has very high chances of conceiving. Around 99% chances of conceiving are on the ovulation day, unless that woman has another problem, which we can talk about. Vivian Kozi Osazi saying, good evening, doctor, good evening to you. Salem Alliance is saying, is it possible to get pregnant at age of 51 without both tubes, with both tubes or fallopian tubes locked? I can say it is possible, but this is something also which is, it has a lot of challenges. First of all is the age. The age is advanced, and with advanced age, you usually find an atrophied uterus. You usually find when the eggs have deteriorated. you usually find when you have the low AMH, hormones get deteriorated, okay? So that wouldn't be a very big issue because we can still stimulate them. We can do hyper stimulation of the ovary, and we can have, in other words, that can be a little bit fine. But again, if you add the problem of blocked tubes, anyway, this is what I can tell you. Number one is that you try unblocking the tubes. Whatever the methods are going to be used, I've already discussed about methods of unblocking fallopian tubes. So the first thing is unblocking the fallopian tubes. That is the first thing. Then you do a fertility hormonal assay, including AMH levels. When you know the AMH levels and all the other fertility hormones, the progesterone, the estrogen, the FSH, the LH, the prolactin, if you know the levels of those hormones, we can now find a way of boosting the hormone that is lacking and do hyperstimulation of your ovary. Then we have, we're back, okay. So same link, all right. So we are back here, and this one is saying, Yosh Explorers, hello doc, how can have pregnant? Oh, I don't get your question. Let me read this one. Salem, no, Aminat is saying, doctor, I noticed my ovulation has not been strong for months. Since I started trying to conceive, again, I took Clomid but started having breast discharge. But I have treated it. How can I boost my ovulation? Of course, you are already taking Clomid. Clomid can be able to boost your ovulation. And I understand, Aminat, you did fertility hormonal assay and the levels of your LH and FSH are low, and that's why you're taking Clomid. So Clomid can help you to do that. But I usually tell people that do not take Clomid when you have not confirmed that your levels of FSH and LH are low. Agnes is saying, is it very effective if you sleep with a man the day after ovulation? A day after ovulation, because I've already said that ovulation usually happens within 24 hours. It expires within 24 hours. We've seen people who go up to 48 hours, and even some go up to 72 hours when they're still having ovulation. So you can still sleep with someone after a day after ovulation, and most times you can be able to conceive. But the best timing is on the ovulation day. Okay. Let me get other questions here. Felix Chipa is saying, can I get pregnant with one left tube? The doctor told me that my right tube is blocked. Yes, it is very possible to get pregnant on one left tube. Very possible. If you have one tube left, and check on one of my videos. Please check on one of my videos. There is a video where we talked about how you can conceive with one fallopian tube. Check in my videos. I gave a very clear explanation on how you can be able to conceive even when you have one fallopian tube. So it is very possible, and if you want to confirm that, or if you want to get details, check on one of my videos. You'll get the answer. Millicent Akoth is saying, "Hello doc, at which month should one go for ultrasound scan?" Ultrasound scan can be started as early as you confirm that you are pregnant. You can go for an ultrasound scan. We don't have the time that you now go there at this time. No, the time when you confirm that you are pregnant, you can go for an ultrasound scan. Maybe if there are specific areas you're looking for. So different times have those specific areas. So maybe if you say you want to know the sex of your child, you want to know the cardiac activity, you want to know ABC, and that's when I can tell you the periods you can know about that. Yoshi Explorers, hello doc, how can have pregnant and uterus has problem for pain, and when you go check, they tell no problem. What can I do? When they check the uterus, and it has no problem, that means the uterus has no problem. So the reason as to why you're not getting pregnant may not be related to the uterus. You can do some other tests. There are several other tests you can do. For example, you can do an HSG X-ray. You can do an HSG X-ray. For example, you can do a fertility hormonal assay. Find out what other problems may be affecting you. Then you can be able to conceive. So that shouldn't really disturb you. Those of you on YouTube, we got a technical glitch, and you know that. So please share the link again to your colleagues so that they can join and get them. Because I'm now answering their questions and they may not be online. Yes, Priscilla, be very fast with your question.
Okay, I was asking, I'm ovulating and I took some clomiphene. Is it possible to conceive twins?
Yeah, it is possible to conceive twins with clomiphene. It is possible. If you took the drugs on the right day, it is possible. Yes, you can.
Yeah, because I started taking it on my 3rd day of menstruation.
Yeah, that's okay. What is the length of your menstrual cycle? Before I say it's okay, what's the length of your menstrual cycle?
I can lie. I think I don't count.
Then you didn't take it on the right day, because it's a person of a 28 day. If you have a 28-day cycle, that's when you take clomiphene on the 3rd day. Any other day, so if you have a different menstrual cycle length, it means you're supposed to take clomiphene on a different day. Yeah, so taking it on the 3rd day, it means, it implies to me that you have a regular menstrual cycle of 28 days. All right, thank you. Mrs. Mackenzie is saying, "Doctor, please, spotting on your ovulation day, is it normal?" Yeah, it is normal. For sometimes some women will spot, will have some light bleeding, very light bleeding when they are having ovulation. So it is normal for people to have spotting or light bleeding during their ovulation day. I did pregnancy test and it was negative, but I have missed my period 2 days now. Yes, that is not an issue. Missing periods for 2 days. Remember, sometimes periods can delay for 2 days, yes, 3 days, even 5 days, even 7 days. It is possible for periods to delay because of many reasons. Number 1, maybe you took some emergency pills. Number 2, you may be having some hormonal fluctuations. Number 3, you may be having anxiety or stress disorders. There are very many causes of that. So that shouldn't worry you. But again, if you miss periods this month and then the next month you also miss periods, then you can be able to run a few tests to identify what the problem could be. Hi doctor, how can I meet you for more discussion basing on my scan reports and hormonal report? Yeah, you can find me at Bikoff Medical Center in Masaka. And if you'd like to book an appointment, go to my website. It is www.druthman.com. You can be able to book an appointment and you get me. Or come direct to the hospital on Monday and Tuesday at Bikoff Medical Center in Masaka. Okay, let's go on with questions. Okay, Yoshi Explorer. Okay, this one asked, finished. Ginika is saying, I had did HSG test. What do you mean? Aminat saying, doctor, I noticed ovulation has not been strong for months since I started trying to conceive again. I took Promin. I think I answered this one. I answered. I have my period 21 of December. When is my ovulation? Vivian Osazi, we can't tell you your ovulation day when we don't know the length of your menstrual cycle. Yes, you can tell us when you saw your periods, but we also need to know the length of your menstrual cycle. When we know the length of your menstrual cycle, we can tell your ovulation day. Okay? Okay. Fahia Muhammad is saying, I got miscarriage 4 times since my wedding 2 years ago. I don't know what are the causes I am suffering that miscarriage. It will not reach even 2 months. I am feeling pain in the abdominal left. Now, there are many causes of miscarriages. Number 1 can be blood group rhesus factor incompatibility. If your blood group is incompatible with your spouse's blood group, if your blood group is incompatible with your husband's blood group, okay, you'll have a problem with keeping pregnancies. You'll have early miscarriages. Number 2, if you have an incompetent cervix, if your cervix is incompetent, okay, if your cervix is incompetent, it's a short cervix with a thin membrane, that cervix will not be able to keep the baby. If you have low levels of progesterone, you will not be able to keep the baby. So there are several causes, and you need to go and run those tests to identify what is causing that. Firidaus Oula is saying, doctor, please, I have a sister who got pregnant twice but lost the babies. What's the problem? I think I've already answered that when I was answering Fahia Muhammad. Okay, Kathy Mbaba's all tests done, only problem is low ovarian reserve. The AMH is 0.4. Nothing else is wrong. So how do I boost egg quality? All right. If your AMH is low, most times when AMH is low, sometimes FSH is high or LH is low. So we need to also study that. Then also look at the levels of progesterone. Because with that, you may also be having a problem with menstruation, with your periods. Now, we need to add several factors. Again, with that, you also need to have your results of HSG and especially pelvic ultrasound scan clear, because with that low AMH, it is also sometimes associated with atrophication or atrophy of the uterus. Now we combine a lot of things. I cannot tell you that take this one drug, but we look at those results. Also, yes, you're saying the other things are fine. Yes, they are fine, but there is what we call lower normal or high normal. So we also look at those results, progesterone, prolactin, closely. So because we are supposed to give you medicines, most people we give them progesterone, we boost progesterone and also give gonadotropins like clomiphene, letrozole, and so on to try and boost that inequality. So it is a complex which will involve like 3 drugs, 2 to 3 drugs, depending on the level of these other fertility hormones and also the results on the ultrasound scan. Also, especially the transvaginal ultrasound scan. Okay. Ginike is a good evening, sir. I did a HSG test, but my tubes are blocked. If your tubes are blocked, go for unblocking. Tubes can be unblocked very well. Tubes can be unblocked, so go and unblock the tubes. It is possible we can unblock tubes. So unblock the tubes, you'll conceive. Arch Roosevelt Matu, doctor, are there treatments for dryness of the vagina during sex? I normally encounter painful penetration during sex due to dryness of my vagina. Dryness of the vagina. I think this question keeps on coming several times, and I've always answered this. Because most women will have vaginal dryness, or women will complain that they don't have enough vaginal fluids. But the reasons are usually three. The first one may be a psychological issue. Then the second one may be related to hormonal issue. And the third one may be related to the technique. So, let us start with a psychological issue. The psychological issue will depend if this woman really loves the spouse they are having sex with. Some people will not be able to get the fluids, to get their vaginal fluids clear when the person they are sleeping with, they are not so much in that intimacy. And sometimes I've also talked to people that you find that you find lovers or someone is married, but in the beginning the woman had vaginal fluids. Along the way, she stopped having vaginal fluids. That comes when there is a reduction in the woman's love has reduced towards you. How does it reduce? For example, if a woman catches their spouse cheating, yes, these women will forgive, but the heart will not forgive. The brain will not forgive. And therefore, it keeps within their brain. So they have that psychological issue, and they, even during sex, they really don't feel you clearly. They forgive, everything is okay, you give them whatever, they are fine, but they are not psychologically okay. They still have that insecurity. That woman will not have enough vaginal fluids. Number two is regarding fertility hormones. Okay? Before I go for fertility hormones, let's go for this one, the technical issue or the technique. Some men, women have different spots where you're supposed to really reach, and this woman releases fluids. So some people just have sex okay, and they're not able to hit those areas where, because some women will not release fluids unless you hit those spots. They are glands, they have glands, okay? They have glands, you can call them wells, okay? All holes that can release fluids. They have taps, I can call them taps, that release fluids. So if you've not, if this sex is really not enticing to them, it is not entertaining to them, and you've not hit those spots where fluids are supposed to come from, they will not release fluids. Lastly is concerning hormones. If a woman has low levels of estrogen, estradiol, if the levels of estrogen or the estradiol levels are low, the woman will not be having enough vaginal fluids. I think that is very, very clear. Alright, so I think we are saying bye-bye to you guys on TikTok. We are stopping TikTok now and continuing on YouTube. So all of you who are on TikTok, go and follow us on our YouTube channel and continue your questions from there. I will say bye-bye for now for those of you on TikTok, and we'll continue our live with YouTube. Okay, so we continue our questions on our YouTube. Archie Roosevelt, I think I've answered you about vaginal dryness. Sylvia Tulimevava, doctor, you have mentioned that only one of 28 cycle should take Clomid on the third day of their menstrual. What if my cycle is not 28? Which day of my period can I take Clomid? If my cycle is 30. If the length of your menstrual cycle is 30 days, take Clomid on the 50th day. I think that is clear. Take Clomid on the 50th day. Rose Natwera, but doctor, I'm watching 2 videos on your YouTube. Is it? I think that happened the other time. We are now having one. Sorry about that. I told you today we've really had a big technical glitch, and IT.next has solved that. So find him on his YouTube channel and follow him. He's the one really trying to put us together. We've had a lot of issues today, but we are now settled. We are stable. Okay. This one is saying, Vivian says, the length is 4 days. What do you mean? Rose Natwera, doctor, is Softico tablet good for pregnancy? Now, Softico tablet, what are you taking it for? First tell me why are you taking it? Why are you taking that tablet? Why are you taking that tablet? First tell me why you are taking that tablet. First tell me why you are taking that tablet. Softico, then I'll let you know. Because what I know with that tablet, it's a vitamin. It's a vitamin D. It's a vitamin D. So why are you taking vitamin D? Do you have a vitamin D deficiency? I don't know. It has no problem with pregnancy. There is no problem with pregnancy. But why are you taking it is the question. Ginike is saying, please sir, can I take mega powder? What is mega powder? You know, some of these things, these are brand names. These are brand names, so I need the constituent. Yeah? What is contained in that mega powder? Those are many brand names. So I need to know what is contained in that powder. Then Sopora Mayusa, we are here. All right. Yeah, the people reduced here because I think we had a challenge with our network, but we are back. Hey, you're here. You're from TikTok? I don't know. Sopra Mayusa, doctor, what causes back pain, craving, losing appetite, and mood during ovulation? It is a result of hormonal fluctuation. I told you that during ovulation, there is a surge in the luteinizing hormone. And when there is a surge in the luteinizing hormone, you will have also some increase in estrogen. And in other words, that hormonal interplay during ovulation is what brings about all those symptoms you're talking about. The craving, the moods, and so on. And feeling like you want to really have sex that time. And that it is as a result of the hormonal fluctuations. Nezima Iman, hi doc, can one get pregnant with both tubes partially blocked? No. No. It will be very hard, and sometimes even when you get pregnant, you'll end up with an ectopic. So if the tubes are partially blocked, you need to unblock those tubes. Vivian, surprisingly, yes, I'm fruity. All right. Vivian Osas, I have my period on 21st December. My ovulation length is 4 days. No, 4 days is not your ovulation length. 4 days is the length of your periods. I need the length of your menstrual cycle. Length of menstrual cycle ranges from 21 to 35 days. So what is the length of your menstrual cycle? That's when I will be able to tell you your ovulation day. Denick Bedward, if someone have endometriosis, every time her period come, her noble bleeding, what can she do? I really don't get your question. But you're talking about endometriosis. Maybe let me talk about endometriosis. Endometriosis is a condition whereby the underlining of your uterus implants itself somewhere else, okay, outside the uterus, and that is endometriosis. And people with endometriosis will end up having a problem with conception. Ginike, please sir, how can I open my tubes? You can open your tubes. You go to the hospital, there are procedures that can be done to open your tubes. For example, we have hydrosalpingolysis. That one can be done to open the fallopian tubes. You can do you can use what they call laparoscopy. You can open using laparoscopy. You can do open surgery. You can also do canalization or catheterization. Okay, Mrs. Gola 2021 is saying, my period comes after 43 and 52 days. What can I do? Those are abnormal periods. Okay, those are very abnormal periods. What you're supposed to do, go and run a fertility hormonal assay. Identify, do tests, do a fertility hormonal assay, identify what is causing that. Secondly, you are going to do an ultrasound scan. You may be having fibroids there. All the problem will be progesterone and so on. So first run tests, identify what is causing that, what is bringing about those abnormal periods, then you can get the treatment. Okay. Gladys Abetel, doctor, they did my husband some surgery on his testicle, but we have taken 6 months, no pregnancy. What can we do? 6 months, we don't think about, 6 months is not, we can't define infertility. That is subfertility. But of course, you start thinking about that. Now, what you are supposed to do, go and run a sperm analysis. Do a semen analysis, find out whether his sperms are normal, whether he has enough sperms. If he has enough sperms and whether those sperms are normal, then you can get treatment for that. Rose Natwera is saying, Doctor, I am 5 months pregnant. Congratulations to you, Rose. But the black area around the nipple area between this are a bit swollen and hard. Any problem there? I'm not so sure. Sometimes it's normal, other times it's abnormal. Now that I'm not able to see it, I can't tell you. But I would love to look at it, examine it, and find out if it's abnormal. So I can't really tell whether it's abnormal or not here. Okay, I think we are now left with 1 or 2 minutes to conclude, and this is going to be my last question. Teddy Bear is saying, good afternoon, doctor. What about when a female on her period? Is it possible for her to see egg white in her periods, and is it possible for her to get pregnant? About getting pregnant, I would request you to go and check. There is one of my latest videos I released. It's concerning whether you can conceive during your periods. So go and check it. But about egg white, discharges during periods are likely, except if this woman has a short, the length of menstrual cycle is short. For example, 21 days, and the periods go up to 7 days, all up to 8 days. Yes, it's possible to see egg white, and they can ovulate when they are still menstruating. For those of you who would like to have a private chat, a private conversation with me, go to my website, www.druthman.com. Book an appointment. We can have a private chat. We talk together and solve your problem. And also, those of you who have challenges with your IT things, you want CCTV cameras, you want IT connections, go to it.next. There is a YouTube channel called it.next, run by the man behind our camera here, Kesberg. It's called it.next. Subscribe and make sure you support the guy, and also ask him questions regarding information technology. And also, please, if you're watching our channel for the very first time, do not forget to subscribe, and also press the notification bell in order to be notified of any important video we upload. I think we are signing out and we are ending today. I'm very sorry. Today we've had a lot of technical glitches. So in other words, I've really disappointed you. We've had a lot of technical glitches, internet connections, everything. So but next time